MIX is the Mental Health Community Integrated Mental Health Service, and it's a community service for patients with complex mental health needs in the community.
The whole point of the MIX service is there for easy access to mental health patients and to support our GP colleagues with their mental health patients. So we can provide things like brief interventions for people, we can provide general psychological support, and we really look at assessing people's needs and what they need at any given point. So we might be thinking about some of their specific mental health needs like anxiety and depression, but we might also be thinking about some of their social needs. So whether they're a carer, for example, or actually whether they have financial needs or drug and alcohol problems or any other difficulties. So we really look at that mental health but holistic picture of what's going on for someone.
MIX started as a sort of an expansion of a pilot project locally in Surrey. It was an NHS England funded project to try and do exactly that, to integrate the services into the community rather than to have the distinct differences between primary and secondary care.
Since we started in May, we've had 82 referrals, so that's 82 people that we've supported, and obviously we work really closely with GPs as well. So some of those people might be people needing mental health support, but also we've, particularly in Surrey Heath, we've identified there's a lot of carers out there who actually need additional support.
Part of the team is employed by Surrey and Borders, and therefore they have more access to the specialist services, obviously referred in by GPs, so we've got a closer relationship with our mental health team.
My role as a community connector is to assess patients that's referred via their GP to our service, to assess their emotional well-being need and to connect them with other resources in the community. We link up the patients, we're bridging patients to services in the community like Catalyst, the Welcome Project, Richmond Fellowship, the CAB and social prescribing.
During COVID, a lot of the world shut down, but actually we know that a lot of people with mental health problems really struggled through COVID. There was a lot of isolation, there was a lot of anxiety around, and a lot of their normal support strategies weren't there, so their support structures weren't there. And actually it was really important for our service to keep going and expand during that time, because it's obviously not just through that crisis point but also that the future. We know that we're going to have many more people with mental health problems and social problems coming through as unemployment goes up, as people have more financial difficulties, and as that level of stress continues.
So patients that I have supported so far, she's in her 50s, she's the carer for her daughter, and she also worked part-time. And during this time she was struggling with benefits, income support, lack of furniture in the home, so I linked her up with CAB to help her with her benefits. Also had a local charity that did amazing work with her. They bought her brand new furniture like a mattress for her bedroom. They're supporting her with wardrobes and also link her up with some food parcel, and she collected food parcel from them, which is fantastic. And we linked her up with Richmond Fellowship as well to help her with employment support.
This service aims to, is for anybody over the age of 18 who has complex mental health needs, who aren't currently under the care of secondary care services, who need more help and support in the community. And we're hoping that we can roll out the service for the whole of Surrey Heath. Initially it's been based on areas with increased deprivation because of the fact that they've often had barriers to being able to access mental health care. And we're aiming to bring this service to everybody so that everyone can have the mental health care within the community for the future.